The topic's name today is treatment of teeth with problematic root canal. The goal of today's lecture to improve knowledge, practical skills and abilities for endodontic treatment of teeth with impassable root canal. It is sometimes impossible to perform the state of root canal treatment, even with the use of modern endodontic tools and preparations for chemical root canal expansions. In order to preserve the tooth with impassable root canal, obliterated, highly covered with fragments of tools and other situations, the root canal shall be impregnated in these situations. Impregnation is the weighting the contents of the impassable part of the root canal with various substances for its transformations into an aseptic material, which for a long time does not undergo putrefactive decay under the action of microflora and tissue fluid. A prerequisite for impregnations is a preliminary necrotizations of the pulp with a devitalization paste. In the case of the treatment of the pulpitis by the vital methods, the pulp in the untrained part of the canal can be detailed using electrochemical necrosis, TRANSCANAL electrophoresis of 10% alcohol solutions of iodine. Methods of impregnations. There are 4 methods: RESORCINOL-FORMALIN methods of silvering, TRANSCANAL electrophoresis, and DEPOFOREZIS. RESORCINOL-FORMALIN methods made in some visit. In first visit, to get a RESORCINOL-FORMALIN mixture liquid, you need to stir the crystal resorcinol in 40% aqueous solutions of formaldehyde. The saturations of the solutions is indicated by the terminations of the dissolution of resorcinol. Several crystals remain undissolved. The catalyst is not added in this liquid. Then the impassable part of root canal is impregnated. How impregnated? A drop of preparate mixture is applied to the mouth of the canal with the help of tweezers and injected into the passable part of the canal with a root needle for 3 minutes. After them, the remainder of the mixture is removed with a cotton ball, and a new portions of the mixtures is placed on the mouth and again pumped into the canal for 3 minutes. This operation is performed 3 times. Then, in the passable part of the canal, a cotton pin is inserted. impregnated with resorcinol-formalin mixture, and the tooth is closed with a bandage made of artificial dentin. A second visit is scheduled in 1 or 3 days. Secondary visit. Repeated the procedure according to the same methods, and again leave the cotton pin with resorcinol-formalin mixture without a catalyst under the bandage for 1 by 3 days. Third visit. Remove the bandage and carry out impregnations with resorcinol-formalin mixture, but with a catalyst. This is 2 or 3 crystals of chloramine, and the procedure is carried out 3 times for 3 minutes. After that, the possible part of the channel is sealed with resorcinol-formalin paste. And to obtain a paste, you need to mix resorcinol-formalin mixture containing a catalyst with zinc oxide powder. If necessary, you can increase the number of visits, but the catalyst is added to the mixture only in the last visit. Resorcinol-formalin mixture is capable of deep diffusion and impregnation with dentin tubules, deltoid branches, and pulp in the unbroken part of the root canal. The mixture is polymerized into a phenolformaldehyde plastic after the addition of a catalyst. As a result, the pulp along with microorganisms is immersed in this glass-like mass, which is not subject to decay. That is, the contents of the pulp chamber are mummified. Disadvantages of resorcinol-formalin methods. Sealers based on resorcinol-formalin have a cytotoxic, mutagenic, sensitizing, and carcinogenic effect on periodontal tissues, and they also significantly change the color of the tooth tissues and make them fragile. You see on picture, change the color of the teeth tissues after resorcinol-formalin paste. Currently, preference shall be given to ready-made drugs. For example, Forident, Forfinam, Resoplast, Resodent, Resortin, and Erfepasta, and other preparations. Special preparations are used to soften resorcinol-formalin paste in the case of endodontic retreatment of the teeth with impassable root canal. For this goal, you may use Endazolve Air by Septadont, Resazolve by Pierre Roland, Selvadent by Vladimir, and Phenoplast by Omegadent. You see this prepared on picture. The next methods of impregnations, the methods of silvering. It involves impregnation, the impossible part of root canal, with silver nitrate. After the recovery of a silver, a thin layer of metallic silver mirror reaction with other name, is deposited on the walls of micro and micro canals, which seals the microflora in the thickness of the dentin. The result of the interaction of silver with pulp proteins is the formation of silver albuminates, which preserve the pulp. Silvering methods may be combined with resorcinol-formalin methods in one tooth. And very often these methods used in child dentistry today. Disadvantages of the silver methods. Silver albuminate is formed mainly on the surface, and in the thickness of the tissues remains variable pathogenic flora because silver does not penetrate there. And the silvering methods are staining the tooth tissues in a dark gray color, and the irritating effect of silver nitrate when it penetrated the apex of the tooth root. The next methods, transcanal electrophoresis. This physiotherapy procedure allows you to introduce pharmacological drugs into the impossible part of root canal and periapical tissues. You see on picture the scheme of methods. This procedure consists from some steps. First step, an electrode with a cotton pin moistened with a 3% solution of potassium iodide, which has an antibacterial effect, is placed in the root canal. You see in picture number 3. And the root cavity is isolated with sticky wax. You see on picture number 1. The optimal current stage is 20.5 or 3 microamperes. The exposure times is 20 minutes. The course of treatment is 3 or 5 procedures. The next methods, DEPOFORESIS. Under the action of a direct electric current, hydroxyl ions and hydroxycuprate ions penetrate to the apical part of root canal and deltoid branches. Copper hydroxide accumulated in the lumen of the canal, partially precipitated and lines the walls of the canal. The collapsed hydroxide cuprate ions occurs in the apical hole in a neutral environment. It passes into slightly soluble copper, secondary hydroxide, which also precipitates. As a result, there is a destruction of the soft tissues located in the root canal and deltoid branches, sterilizations of the lumen of the canal, and the apical part due to strong bacterial actions, and hermetic closure of the micro channels, stimulation of osteoblast functions due to alkalinizations of the environment. The method of DEPOFORESIS. First, the root canal is passed through and expand by at least 1 to 3 of its length. 1 from 3 part of its length. And a suspension of copper calcium hydroxide is introduced into this passable part of root canal, and a needle electrode is placed in the canal, and electric circuit is closed, and the procedure is performed. The procedure times is calculated based on the fact that during one lesion, one root canal shall be received 5 microamperes on 1 minute of electricity. The procedure is performed 3 times every 7 or 14 days. After the possible part of the root canal is sealed with a copper-containing paste in the last visit. Copper-containing paste represents today's Cupraden by Vladimir, Cupratin by Technoden, and Cupral by Humanheim. Or maybe used for sealing root canal copper-containing cement. Atacamid, the name with cements, Humanheim by Humanheim. German. You see on picture the result by use DEPOFORESIS for treatment destructions of bone in apical tissues of tooth. First picture before treatment, after. The next picture after treatment. On first picture you see region by destruction of bone. On next picture you cannot see this region. Thanks for your attention.